Good afternoon, ladies and gentlemen, and welcome to today's Eating Disorder Hope webinar. Our topic for today is Navigating Eating Disorder Treatment in Canada with our special guest, Cara Vaccarino, who is the Executive Director at the Bellwood Health Services. Before we get started, I would just like to take the opportunity to let you know of a few things about your control panel as an attendee for our webinar today. You can submit text questions to today's presenter by typing your questions into the question pane of your control panel. You can send in your questions at any time during the presentation. We will collect these and address them during our Q&A session at the end of today's presentation. And I would now like to introduce our presenter, Cara Vaccarino. Welcome, Cara, and thank you so much for joining us today.
Thank you. It's my pleasure to be here this afternoon, Jacqueline.
And today you are presenting on navigating eating disorder treatment in Canada. And we're so looking forward to everything you'll be sharing, as this is a very important topic and something that is not as well known here in the United States. So without further ado, we'll turn it over to you for your presentation.
Okay, well, thank you very much to all the attendees out there, wherever you may be. It's a pleasure to be here this afternoon and look at the prevalence of eating disorders in Canada. We're going to look at some of the obstacles to addressing eating disorders amongst Canadians, some of the challenges and barriers to access We have about 35 million people across the country, which is you have about 10 times greater population than Canada. But we have about 600 to almost 1 million people in Canada at any given time that could be diagnosed with an eating disorder. Among those with anorexia nervosa, there is between a 0.5 and 4% prevalence of women in Canada. Bulimia nervosa affects between 1 and 4% of women, and then we see binge eating disorder affecting about 2% of all people in Canada, men and women. We can see from our Stats Canada reports that anorexia nervosa in particular leads to the estimated deaths greater community-based supports, greater education. There's a lack of outreach amongst adolescents in our school system There continues to be very entrenched stereotypes and stigma associated with eating disorders across the country. And of course, there tends to be a bias in the healthcare field against patients with these disorders, as well as all mental health and addictions concerns in general. There's also significant need, as in the United States, to increase education around in primary care settings amongst our gatekeepers to the healthcare system, family doctors, and often nurse practitioners. In Canada, we see that there is, unfortunately, a significant lack of treatment programs available for eating disorders. We'll go province by province a little bit later in the presentation to draw diagnosis and prevention work. And of course, as there are in most developed countries that offer specialty eating disorder programs, there are financial roadblocks. In Canada, the roadblocks are more around access and the lack of an adequate number of treatment facilities and inpatient services available to treat eating disorders. So the financial roadblocks still persist, but not in quite the same way as our U.S. counterparts. With our publicly funded eating disorder treatment programs, oftentimes patients face a lengthy wait times. These wait times are particularly potentially lethal for patients facing extreme underweight and malnourishment. The lengthy wait times are much more severe, again, in rural information. So as you can tell, some of the obstacles, challenges, and barriers to treatment are similar in the United States as in Canada. When we look at the Canadian population, we look at particular challenges faced by marginalized populations. We have a very large Native Canadian population that has difficulty accessing all types of mental health and addictions treatment. Some of the opportunities around outreach for new Canadians and ethnic minorities are significant, as well as for members of sexual and gender minority groups. There are some groups across the country that are looking at research in terms of access for marginalized populations in the country. So this is Canada. It's humongous, really. by the provincial and territorial on a territorial and provincial basis, and guidelines set out by the federal government. The Canadian healthcare system is held, the publicly funded or our socialized healthcare system is held in very high regard with the population. It is Canadians are born with the with a legislated entitlement to access to free health care. Of course, that leads to huge opportunities, but also some significant challenges when it comes to meeting unmet demand. Mental health and addictions treatment in Canada, much like in the United States, is proportionately underfunded relative to other areas of healthcare. So in Canada, we have so every province basically receives an envelope of money, and it decides how it's going to spend its money. So different service planning tables come together. They decide how many inpatient beds are necessary. They'll choose a strategic location to place those beds. They'll complement the inpatient side of the house with a day hospital and maybe some residential programs. The outpatient providers, by and large, are very similar to the United States types of outpatient providers. These are typically, very small, publicly funded outpatient providers, but then quite a large number of private psychologists and therapists in private practice, providing usually aftercare or work with patients post-day hospital or inpatient funding. So you have a very kind of provincially mandated system in Canada that's really designed around health population. This program a couple of weeks ago when I was in Vancouver, and it's beautiful. It really is quite good. Outpatient providers, as I said, are by and large private practitioners spread throughout mostly urban centers. A big problem in Canada is that we have a lot of rural communities that have a tough time accessing any specialty treatment, mental health, addictions, but even specialty medical types of procedures and treatment. The cities are pretty accessible in terms of programs and services, but once you get to past the kind of the greater boundaries of the city, it gets much tougher. In our western to mid provinces, Alberta, Saskatchewan, and Manitoba, we've pretty much grew Ontario is where we see the vast majority of eating disorder treatment. There's 13.6 million people in the province of Ontario. Ontario is really the central hub of business and industry in Canada. It's much like your New York or your California. It really is sort of that sets the stage for the entire economy across the country. So in Ontario, we see a large concentration of academic health science centers and a lot of research money coming from the federal government. In Ontario, we have 3 inpatient programs for adults, but between 3 hospitals, there are only 20 beds. We have 4 adolescent inpatient and 4 children programs inpatient, but those are only about 28 beds. Because of Montreal and McGill University, they do have a significant concentration of academic, of academic centers, both English and French. There are 2 adult programs, 1 French, 1 English, 2 adolescent, 1 French, 1 English, and 1 children's program, eating disorder program in Quebec. That's French. They have day hospital treatment available for both French and English residents in Quebec, and then a number of outpatient providers, both Francophone and Anglophone speaking or providers there. In the eastern part of the country, we have the provinces of New Brunswick, Nova Scotia, Prince Edward Island, Newfoundland, and Labrador. All of those provinces collectively only constitute about 2.4 million people. So again, we're a vast country that's sparsely populated compared to the U.S. A little service for adolescent and children with eating disorders. So here, because these provinces are relatively sparsely populated, I guess it's more efficient to send patients with eating disorders to centers of excellence in larger urban areas. Here we are if you live in the Northwest territories, the Yukon, or some of our native Canadian territories up north, you're plumb out of luck if you have an eating disorder. There's absolutely no programs or services in those remote communities whatsoever. There are some pretty decent sized cities, Yellowknife, for example, in the northern part of the country, but again, those provinces or territories will pay for those residents with eating disorders or really requiring most specialty treatment to come to large urban centers in Vancouver or Toronto or Montreal. Okay, so private residential eating disorders treatment. This is an option for Canadians who have significant eating disorders, who need inpatient treatment, but either are facing long wait times to access a fully funded provincial inpatient bed. They can pay for services, and we have one program in Manitoba that's privately funded, and then two in Ontario, including ours, Waterstone Clinic. So what happens here is very, very similar to the U.S. treatment centers, except that we're much less expensive than a U.S. A comparable treatment center. So that there we actually do get American patients from time to time coming to Waterstone for treatment, because with the exchange rate on the Canadian dollar, it's much less expensive for them to come to Waterstone or Bellwood than to stay at home for treatment. Of course, that's not ideal in terms of engagement with family and other things, but because some of the treatment centers, many of the treatment centers in the U.S. are cost prohibitive, there is an opportunity for people to get care that way. One of the big problems that we face in the provincially funded programs is that concurrent eating disorders and addiction issues are not treated. So in Canada, I should clarify this, because when I moved from the States back to Canada, there was a different vernacular around this. So in the United States, or addiction. So it's a huge problem, because we know that there's a high co-occurrence of substance use disorders. We look at 12 to 18% of patients with anorexia nervosa have, and upwards of 30 with bulimia nervosa, have some type of substance use disorder, as compared to only 18% prevalence in a community sample of normal subjects. So there's often need in that case for people who have a substance use disorder and an eating disorder to pursue private treatment. And we actually here at my treatment center specialize in the treatment of concurrent eating disorders and addictions. So there are full continuum of care also for concurrent treatment. We have there's residential, partial, IOP, individual. So I think it's worth noting that there's huge and significant community-based advocacy and support programs available across Canada. We see this again highly concentrated in urban centers, where people who are in recovery or who have children in recovery or struggling often develop foundations or charitable organizations that lead to wonderful, wonderful things. The Waterstone Foundation was formerly associated with our treatment center, but continues to fund private treatment and do a lot of amazing work for people in Toronto. Sheena's Place in Toronto is sort of the go-to place for support, ongoing support and education for people with varying degrees of eating disorders. This Sheena's Place is a wonderful place that was started by some moms who have field of eating disorders in Canada. I wanted to give a shout out to some esteemed researchers in the field of eating disorders. Dr. Paul Garfinkel, who wrote the landmark book Anorexia Nervosa, Multidimensional Perspective, is often referred to as the grandfather of eating disorders in Canadian healthcare. He has a large group of senior residents and students that have all followed in his footsteps and gone on to make significant contributions in academic circles and research. So you will see at the international meetings, AED coming up in San Francisco, there's always prominent Canadian researchers featured across the board. So we have a high degree of pride, experience, and investment in eating disorder research in Canada. So here are some of the references that we use to put together this talk and my contact information. And I'm happy to take any questions at this point. Right, Jacqueline? That's the order of things, I guess.
Yes, and thank you so much, Kara, for your excellent presentation and overview just on how treatment works in Canada for eating disorders. It was very interesting. So to all our attendees, as a reminder, you can still submit questions to the question pane in your attendee control panel. And we do have a few questions, Kara, if that's okay. One of our attendees is wondering, are there any collaborations between the United States and Canada when it comes to eating disorder treatment?
So there underweight. Those patients had, they were really, really sick, and if they're really, really sick and need to be in the hospital and there's no bed available, what the provincial government would have done and had done was pay for them to go to a program somewhere in the United States. When I was in the U.S., I was Chief Operating Officer of River Oaks Hospital that housed the Tulane University Eating Disorder Program, and we got patients from Ontario to that facility. The Ontario government has dramatically decreased. They've really good job at reinvesting or investing more money in eating disorder treatment in Ontario. They've done a phenomenal job at reducing the number of patients having to go to the U.S. for treatment. Wait lists have reduced dramatically in Ontario. So they weren't necessarily organized partnerships. We participated in Canada in some of the genetic studies out of the States. So there's in terms of academic circles, there's lots of collaboration for sure on the research front.
Wonderful. Thank you so much for that response. And it's good to hear just of the collaboration between our two countries. Another question submitted from one of our attendees is asking, where do you see the greatest areas for improvement in treatment for eating disorders in Canada?
Um, so I guess I'll draw just upon some of my experience in the U.S. There's the vast majority of inpatient treatment centers in Canada are housed in hospitals. So they're highly institutionalized and medicalized environments. Uh, best practice, empirically validated treatment programs that exist in a healing, positive, and aesthetically desirable location. So, at Waterstone Clinic and Bellwood, we hope to offer people those types of options if they are really sick and need eating disorder treatment, but want to maybe have a more holistic experience with sort of some more of the ancillary types of services and options. So there is more than ever a greater appetite in Canada for private-public partnerships. As I said earlier, Canadians hold their national health plan in almost as a religion. It's a very the Canada Health Act is kind of like the Constitution in the United States. You can't really mess with it too much, and nor do we want to. But people are looking for more options in the way of treatment. So
Differences that you've observed working in both the United States and Canada in the eating disorder treatment field?
okay, that's an easy question. So in care environment, it's, as you guys, I'm sure some of you out there can relate, it's getting eating disorder treatment for patients who are theoretically well insured is still like pulling teeth. You have to go to great lengths to even justify an inpatient admission, and then once they're admitted, you have to continue to justify in a very exhaustive way why they continue to need to be in hospital, and it's only a matter of time until their benefits are exhausted, and then they're left either to need to pay out of pocket or be discharged. So there's a lot of frustration, in a very different type of frustration in the United States around access and continued treatment. Now, I understand since I left the U.S., some of that has gotten much better. But so in Canada, you don't have that level of frustration. Once a patient is admitted to an inpatient program, they pretty much get to stay till they're better. So, it's not dictated by insurance provisions or finances. Once you get into a publicly funded bed, you get to stay until you get better. So that's what I would say is just access. There's access problems on both the Canadian U.S. Scenes, but the access problems are a little bit different.
Very interesting. Thank you for sharing that. And another question from an attendee is wondering if you know the average length of stay for residents in inpatient programs in Canada.
So by and large, as I of the financial confines that you face in the US.
Right. Thank you so much for speaking to that. Another one of our attendees is wondering what treatment options are available for patients with co-occurring eating disorders and substance abuse. As you mentioned, it's something that's very common.
It is very common, and unfortunately, this is one of the biggest problems we face in Canada is the publicly funded um, programs by and large, like the largest one at Toronto General. If you have an active addiction, they you can't be admitted to the eating disorder program. So, I mean, at Bellwood Health Services, we provide probably the best option for concurrent treatment. Waterstone Clinic and Bellwood work together to tackle both issues concurrently. Waterstone Clinic is a best practice, all DBT trained. Bulimia and anorexia under control, and then you can get treatment for addiction. So unfortunately, oftentimes there's still that very siloed approach to taking care of people, and we all know that that's not how people really work. So that's sort of the struggle we have here in the publicly funded system. So the options are more on the private end of things.
Right. Thank you so much for explaining that. And if we can ask one more question from one of our attendees, is wondering what are the long-term success rates for patients who go through eating disorder treatment programs in Canada?
Okay, so I can speak to that in terms of they're really no different in the States as compared to Canada. I the outcome studies are typically done by is very sophisticated and well developed relative to some of the their Canadian counterparts. So there's a lot of checks and balances in the U.S. healthcare system that don't really exist here yet. That's changing, however. We have some changes in healthcare funding that are going to really place more focus on outcomes. So I look forward to that personally because it's an important question, and you know, value is the big buzzword now in healthcare, and there needs to be accountability on all of our parts to prove value to customers and patients and consumers alike.
Definitely. Thank you so much for addressing that. I know that's a complex question, so we appreciate your thoughts. Thank you so much again, Kara, for a very educational and informative presentation, and we would appreciate if you could complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. So on behalf of Eating Disorder Hope and our presenter, the lovely Kara Vaccarino, we want to thank you again for joining us today. Thank you again, Kara, and everyone have a wonderful day.
My pleasure. Thank you so much.
Bye-bye.